Brian Haynes. Robert Brian Haynes OC is a Canadian physician, clinical epidemiologist, researcher and an academic. He is Professor Emeritus at McMaster University and one of the founders of evidence-based medicine. Haynes has published more than 390 articles in peer-reviewed journals and has authored/edited 14 books including Clinical Epidemiology, a basic science for clinical medicine, and Evidence-Based Medicine, how to practice and teach. His research interests include improving healthcare through knowledge translation and applying the findings of high-quality healthcare research in clinical practice settings. He is involved with development and testing of evidence-based information products and services in clinical care. Haynes is an Officer of Order of Canada. His work has been acknowledged through awards, peer elections, and honorary fellowships from national and international organizations. Major honors include a National Health Scientist Career Award from Health Canada, the American College of Physicians Rosenthal Award, Hypertension Canada George Fodor Award, and Council of Biology Editors Award for Meritorious Achievement. He is Fellow of Royal Society of Canada and Royal College of Physicians and Surgeons of Canada and an Honorary Fellow of American Medical Writers Association. Education. Haynes completed his pre-medical studies from University of Calgary in 1967 and then enrolled in the Faculty of Medicine at University of Alberta until 1971. During this time, he was an MRC Summer Research Fellow in Physiology and Pharmacology and completed his BSc degree in 1969. In 1971, he was awarded a gold medal upon his completion of medical doctor degree. He completed his MSc and PhD under David Seckett from McMaster University in 1973 and 1975 respectively. In 1977 he became a Fellow of the Royal College of Physicians of Canada Internal Medicine. Career. Right after his PhD, Haynes was employed as a senior medical resident at Toronto General Hospital in 1975. From 1977 till 1981 he taught at McMaster University as an assistant professor and was promoted to associate professor in 1981. During this time he was associated with University of Toronto as a visiting health scientist. Haynes taught as a professor at McMaster University from 1985 till 2016 and then retired as Professor Emeritus. He also chaired the Department of Clinical Epidemiology and Biostatistics at McMaster from 1998 till 2008. He is an inaugural member of the Cochrane Collaboration Cochrane Organization, a member of his first board. He started and led the Canadian Cochrane Centre and Network. Research and work. Haynes' research focuses on improving healthcare through knowledge translation, clinical epidemiology, application of the validated healthcare knowledge, development and testing of evidence-based information products related to clinical care, randomized trials of medical and surgical procedures. He has also worked on patient compliance with therapeutic regimens. Haynes published an article in 1976 about improving patient compliance in hypertension. He assigned 38 hypertensive and medically non-compliant stale workers to either control or experimental groups and taught them to measure their blood pressures and create charts about their blood pressures. He also assigned the experimental group weekly visits from a non-professional high school graduate who reinforced regular pill-taking behavior. As a result of this experiment, compliance of the control group decreased while it increased in the experimental group. In an article in 1979 about clinical measurements and detection of patient non-compliance, he stressed the importance of measuring patient compliance accurately in order to manage low patient compliance. He devised and evaluated methods of assessing a patient's medical compliance and suggested against using a patient's health beliefs, traits and perceptions as criteria for measurement of compliance. Haynes then shifted his research focus on documenting the problems of evidence handling by practitioners and proposing solutions. He wrote an article explaining the constraints faced by medical practitioners in handling research and clinical evidence. Haynes suggests the use of measurement principles and information tools to reduce the inaccuracy in the data gathering, interpretation, communication, and application of the research evidence for patient care. Haynes worked on evidence retrieval from bibliographic databases and published over 50 articles on the theme of developing optimal search strategies for detecting clinically sound studies in Medline, as well as EMBIS, CINAHL, and SICK-LIT. He aimed to design efficient search strategies and conducted a survey about the characteristics of search strategies for studies that would provide high-quality evidence for use by clinical practitioners, medicine, nursing, rehabilitation. He pioneered the use of machine learning to empirically determine the optimal search filters for various types of studies, e.g., prevention, treatment, diagnosis, prognosis, causation, quality improvement, and cost-effectiveness. His research validates the empirical search strategies for enhancing the retrieval of articles. After the documentation and retrieval of evidence, Haynes worked on synthesizing the evidence retrieved. He authored a review with his colleagues about the interventions to encourage people to follow medical prescriptions. He summarized the results collected from randomized controlled trials of interventions. The article concluded that there is a dire need for innovation in the methods to assist and encourage patients to follow the medical prescriptions. Haynes' research has resulted in structured abstracts of medical journal articles along with online search filters such as clinical queries, which are often used by Medline, EMBIS and other bibliographic databases. He created the Health Knowledge Refinery at McMaster University's Health Information Research Unit, which provides organizations, clinicians and medical textbook publishers and authors with current and most effective evidence for practice. He is one of the originators of evidence-based medicine, led by David Sackett, along with Gordon Guyatt, Peter Tugwell and Deborah Cook, for which his work has been critically acclaimed. Awards and honors. 1985 Fellow, Academy of Behavioral Medicine Research. 1992 Fellow, American College of Medical Informatics. 1998 American College of Physicians Rosenthal Award for notable contributions to improve clinical care in internal medicine. 1998 Council of Biology Editors Award for Meritorious Achievement. 1998 Honorary Fellow, U.S. Medical Library Association. 2000 First Prize, Basis of Medicine Section, British Medical Association Book Competition. 2001 Honorary Fellow, American Medical Writers Association. 2004 Senior Investigator Award, Canadian Society for Internal Medicine. 2004-2006 Master, American College of Physicians. 2007 Fellow, Royal Society of Canada, Academy of Sciences. 2009 Member, U.S. National Academy of Medicine. 2010 Officer, Order of Canada. 2010 Roger Catay Medal of Excellence in Health Informatics for 2010, National Institutes of Health Informatics. 2013 American College of Physicians Ontario Laureate Award. 2013 Hypertension Canada George Fodor Award. Selected books. Compliance in Healthcare. Johns Hopkins University Press, Baltimore, 1979. Clinical Epidemiology, a Basic Science for Clinical Medicine. Little, Brown, Boston, 1985. Evidence-Based Medicine, How to Practice and Teach EBM. 1997 Evidence-Based Medicine, How to Practice and Teach EBM. Second edition. London, Churchill Livingstone, 2000. Evidence-Based Medicine, How to Practice and Teach EBM. Third edition. 2005 Clinical Epidemiology, How to Do Clinical Practice Research. 2005 Evidence-Based Medicine, How to Practice and Teach EBM. Fourth edition. 2011 Evidence-Based Medicine, How to Practice and Teach EBM. Fifth edition. 2019. Selected articles. Nilatar Wilczynski N, Navarro T, Hobson N, Jeffrey R, Keepanasrella, Agoritzis T, Mistrayan, Iorio, Jack S, Sivramling MB, Iserman E, Mistaf R, Chidrisuski D, Cotta C, Haynes Abi. Interventions for Enhancing Medication Adherence. Cochrane Database of Systematic Reviews 2014, Issue 2. Ott. No. Davis D. A. Thompson M.A. Oxman A.D. Haynes Abi. Changing Physician Performance, a Systematic Review of the Effect of Educational Strategies. Choma 1995, 274, 700-5. Gog Axatic Horien, MacDonald H., Roses Erlano MP, Devero PJ, Bean J., San J. Haynes Abi. Plate of Computerized Clinical Decision Support Systems on Practitioner Performance and Patient Outcomes, a Systematic Review. Choma 2005, 293, 1323-38. Oxman A.D. Thompson M.A. Dalis D.A. Haynes R.B. No Magic Bullets, a Systematic Review of 102 Trials of Interventions to Improve Professional Practice. Kimeda J. 1995, 153, 1423-31. Cook D.J. Murrow C. Haynes R.B. Systematic Reviews, Synthesis of Best Evidence for Clinical Decisions. Annentonmet 1997, 126, 376-80. Hunt D.L. Haynes R.B. Hannah S.E. Smith Kelvin. Effects of Computer-Based Clinical Decision Support Systems on Physician Performance and Patient Outcomes, a Systematic Review. JAMA 1998, 280, 1339-46. Haynes R.B. Montague P. Oliver T. McKibben K.A. Browse M.C. Kanani R. Interventions for Helping Patients to Follow Prescriptions for Medications. Cochrane Review. In the Cochrane Library, Issue 3, 1999. Oxford Update Software. O'Brien M.A., Rogers S., Jamfed G., Oxman A.D., Udgard Jensen J., Christopherson D.T., Versetland L., Bainbridge D., Fremantle N., Davis D.A., Haynes R.B., Harvell. Educational Outreach Visits, Effects on Professional Practice and Healthcare Outcomes. Cochrane Database Systrev 2007 OX 17 4 CD 409. Haynes RB McKibben KA Kanoni R Systematic Review of Randomized Trials of Interventions to Assist Patients to Follow Prescriptions for Medications. Lancet 1996 348 383-6. Haynes RB Wolczynski NL McKibben KA Walker CJ Sinclair JC. Developing Optimal Search Strategies for Detecting Clinically Sound Studies in Medline. J.A. Med Informis OC 1994 1 447-58. Sackett DL, Rosenberg WMC, Grey Jam, Haynes RB. Evidence-Based Medicine, What It Isn't, What It Isn't. BMJ 1996 312 71-2.